Even though respiratory syncytial virus is often mild, it can cause severe illness. It is one of the most common causes of bronchiolitis and pneumonia in babies. Certain infants have a higher risk of complications related to an RSV infection, and preventing RSV in your baby could help reduce the spread to those higher risk babies. Even if your baby is at a lower risk for severe infection, it is not always clear which children will progress to a more severe infection. RSV can spread from direct person-to-person contact with saliva, mucus, or nasal discharge, unclean hands, or unclean objects or surfaces, toys, keyboards, doorknobs, etc. These are a few things to help with prevention of RSV. Cover your coughs and sneezes with a tissue or your upper shirt sleeve, not your hands. Wash your hands often with soap and water for at least 20 seconds. RSV could survive 30 minutes or more on unwashed hands. Avoid close contact such as kissing, shaking hands, and sharing cups and eating utensils with others. Clean frequently touched surfaces such as doorknobs and mobile devices. RSV can survive up to 6 hours on surfaces, toys, keyboards, doorknobs, etc. Try to avoid other children and vulnerable adults when sick. If your child is at high risk, they may qualify for a medication called palivizumab, which is given as monthly shots during RSV season. Your child's pediatrician or healthcare provider should know if your child is a candidate for this prevention medication. If you're pregnant or have recently given birth, your child may be eligible for the RSV vaccine if and when it becomes available. This can slow the spread of RSV overall to help protect your child and others.